Good morning, students. Yes? Yes. I'm going to share the screen and tell me whether it's clear. Okay. Can you see the screen?
Yes.
Okay. So we started the introduction to anatomy and physiology. The last class I couldn't take. So here the systems what you are going to learn and the practical books and assessment, how we have been evaluated. Okay. What is a gross anatomy? So some terms I told some terms which is useful, which is very much important to continue the anatomy and physiology. So what is a gross anatomy is what you can see from your eye, unaided eye, naked eye. That's gross anatomy. Studying the gross anatomy is whatever you can see from your eye without any aid. Aid in the sense magnifying glass or microscope or any other aids. Comparative anatomy is comparing because it's very important for animal because they are animal classification. So many categories, non-ruminants, ruminants, even the ruminants, cattle, sheep, goat. So different. So because of that, you're comparing. If it's a kidney, bovine kidney, even the goat kidneys are very different. Digestive system is comparatively different. So that's what we are studying, comparing. Embryology is the developmental study, starting from conception till the birth. Microscopic anatomy, ultrastructure, so these things. And how you name the study. Ology refers to the study. Osteoskeletal system. So some parts. And descriptive term, that's very important. Cranial and anterior refers towards the head. Caudal and posterior towards the tail. Cranial and caudal. Okay. Median plane passing through the body, craniocaudally, which divides the body into right and left equal halves externally, not internally. So then there's the midline which is going there. Let's divide the body into left and right equal halves. Okay, that's close to the mid-abdominal, proximal. Away from that we call distal. Abdominal side, ventral, we call ventral side. Dorsal side is close to the vertebral column. Palmar plantar, that I told. These are different planes: sagittal planes, median planes, transverse plane, frontal plane. Okay, so this one gives you all kind of idea. What is the median plane? Right body into right and left equal halves. Dorsal plane, that divides the body into upper and lower segments. Okay. And the transverse plane, which is divide the body into a front. Okay, front and the transverse plane. Transverse plane is a plane which is at the right angle to median plane, divides the body into cranial and caudal. Cranial and caudal. Frontal plane, which is a plane which is right angle to both median and transverse. Frontal divides the body into upper and lower segments. That's the dorsal plane which is shown in the picture. Median, lateral, close, lateral, away. Okay. Dorsal, ventral, deep, internal. Superficial is something proximate to the skin or the surface. Distal is away from vertebral column. Proximal, close to a given part, whatever. It's not only the head though, it's not only refers to medial. Whatever close, proximal to whatever. Okay, distal is away from that. Palmar and plantar. Okay. So microscope, and just tell me where I stopped. Shall I start? Did I start? Microscopic anatomy. Where did I stop? Can one tell me? Unmute and tell. Where did I stop?
Yes, ma'am.
Here, from microscopic anatomy.
Yes, ma'am.
Okay. So it's a single cell, so that can perform all functions, including growth, metabolism, and responding to stimuli, contraction, reproduction. So this group of cells, tissues. So the tissues, various tissues associated in a functional group to perform a function called organ, and a group of organs involved in a common enterprise to make up a system. So there are 4 primary tissue types, so that you may know: epithelial, connective tissue, muscle tissue, and nervous system. Nervous tissue, epithelial tissue, which covers the body surface mainly. Sometimes body surfaces, inner lines, body cavities, outer lines of body cavities, and form the active parts of glands. Connective tissue that supports and bind the tissues together, connective and form, which is in the case of bone marrow, they form elements of the blood. So there are some connective tissue, exceptional, specialized connective tissue, bone and the blood. Okay. Because of their basic structure, we call them connective tissue. Muscle tissue, especially in contracting and relaxing. Nervous tissue conduct impulse from one part to the other. So the next topic will be the nervous system. The epithelial tissue, in general, the epithelial tissue are classified as single and stratified, many layers. Single or simple layer, stratified many. Simple squamous epithelium is usually thin, plate-like. The thin types of cells are found as coverings of viscera and lining of body cavities and blood vessels, mainly. You should know where these types of connective tissue are found. You should be able to give examples, and you should be able to identify histology. What is a histology? Gross anatomy, you know. Histology is what you study through microscope. Microscope, various powers are there. Objective lens, okay. Eyepiece, there are 2 eyepieces which is close to you. You look through from your eye, close to your eye, that is the eyepiece. Objective lens is the lens close to the slide that you know what you are going to see. So, way of making histology slides, I will give a very brief in the practical. So how you are making a slides from a section, if you want to study these tissues, so you have to cut, okay, using this microtome, which is an instrument used to cut the tissues. Okay, so if you want to get the piece, if you want to study a part of the esophagus, you have to get the esophagus from the animal. You have to cut it small piece, maybe 2 centimeters thick piece of the esophagus, embed in the wax. Then you use to cut using the microtome, make it thin pieces, put it on the slide, fix it, and you can use the stain, because without stain you cannot see everything black and white for the microscope. So you have to color it. Stain. There are various stains are there. H&E, hematoxylin, eosin, which we use commonly to study these tissues, internal organs, internal parts of the cell. So that's H&E. Van Giesen is there to, especially to study this connective tissue. There are fibers are there, collagen, elastin, different types of fibers. To study that, we use Van Giesen, Ziehl-Nielsen. So there are different types of states to study different components of the cell. So these things will be taught in practical class. If not, please ask, because these are very important. Sometimes when the practicals are taken by demonstrators, assistant lecturers, they may miss this, but you have to ask from them how to prepare a slide to see the microscope. Okay, then cuboidal epithelial cells are equal in all dimensions. So that's what you say, cuboidal. That's found in some ducts and the passageways of kidney. Then the columnar, mostly cylindrical cells, found in trachea. Pseudo-stratified columnar epithelium, they are composed of columnar cells, but seems like stratified. Pseudo means false stratified. They are one layer, but it's appear like many. Okay, but they all lie on the basement membrane. Epithelial tissue is the component of epithelial cells. Tissue are the basement membrane. The cells are lying on it. Simple layer or stratified. Stratified many layers, and those layers, only one layer is lying on the basement membrane. Others will be close to attached to these layers of cells. But here in pseudostratified, all these layers of cells are attached to basement membrane. But it's appear like pseudo false, giving the appearance of more than one layer. So that's pseudostratified. Upper respiratory tract epithelium. Okay. Stratified epithelium consists of more than one layer of cells. Stratified squamous epithelium forms outer layer of the skin and lining the first part of the digestive tract as far as to the stomach. So in case of the digestive system, the type of epithelium, inner lining, it's different, okay? Because mouth, esophagus and the stomach is having sort of grinding function. A lot of grinding, different kind of food are ingested, human, we also eat soft food, hard food, different type of textures of the food. Even the animal, they eat roughages, grasses, very coarse, straw, hay, those things are very coarse. So those kind of, when they are going ingested, they may damage the inner lining. So that's what it has stratified, many layers of squamous epithelium. From the stomach, so the stomach also, sort of mixing and blinding is there. So after that, the simple columnar, because absorption has to be taken. Digestion and absorption. Digestion sends some things to secrete. So secretions, which is having a single layer usually. Absorption also single layer. The stratified columnar epithelium is composed of more than one layer of columnar cells, and it's found in lining part of pharynx, salivary ducts. A transitional epithelium forms the lining of those portions of the urinary system that are subjected to considerable stretching. So when the stretching is needed, it has this transitional epithelium. One time it seems like squamous or cuboidal. Once it's stretched, it's like cuboidal. Once it's stretched, it's like columnar or glandular epithelium, which is often either cuboidal or columnar. The cuboidal or columnar has the ability to separate various products. So that's glandular epithelium. They often secrete many things. Okay. Then the connective tissue. Connective tissue, they give form and strength to many organs and often serve for the production and leverage. Okay. So moving and binding and protection. Connective tissue includes yellow elastic tissue, collagenous white tissue, reticular tissue, adipose tissue, cartilage, and bone. So adipose tissue is usually called as fat in adipose tissue. We don't say fat here. In anatomy, we used to say adipose tissue. Okay. Cartilage is a specialized type of connective tissue. So cartilage you find in many, they are called as crystal. So it's firmer than fibrous tissue. Cartilage is firmer than the fibrous tissue. So this type of cartilage described as hyaline, elastic, and fibrous. These things you study very detailed in your practical. Okay. So don't worry about this connective tissue, epithelial tissue. You will be studying very detailed in practical histology. Okay, HNA stain slides usually. Van Giesen slides to connective tissue. Okay, fibers are stained very clearly in Van Giesen. HNA also we can use to study these connective tissue components, all these. Bone is formed by bone-forming cells. They are called osteoblasts. So see the names osteoblasts. Osteo refers to skeletal system. So that's what osteology. Osteoblast, blast means something generating. Okay, there are different cells are there, so that's what I want to emphasize. Osteoblast cells, bone forming cells. Osteoclast cells, C, A, B, C classed. Okay, those cells are involved in remodeling. You know, when there's a fracture to bone, when there's a damage to bone, so bone is already formed and it is having a damage. So osteoclast cells, they involved in this remodeling of bone. Forming the bone, osteoblast, involved in repairing, remodeling is osteoclast cells. Okay, different osteoclast cells. Blood cells, blood consists of fluid matrix. So you know, connective tissue is having a ground substance and the cells. Ground substance, which is not a living, non-living thing. It may have some lot of things. That's ground substance, and the cells. Cells are usually fibers forming cells. Could be chondrocytes, osteocytes, cytes in the sense cells. Okay, osteocytes means bone cells. Chondrocytes means which forms the cartilage. Chondro. Okay. Connective tissue, ground substance. We have cells and the ground substance. Okay. Blood consists of a fluid matrix. Matrix is the one we call the ground substance, which is the plasma in blood. So that's what the blood is classified as connective tissue. Why? It has a matrix and the cells, a variety of cells, and the fibers. So if it is saying like connective tissue, it is having the ground substance. That's the matrix, cells, fibers in it, embedded in that. So that's what we call connective tissue. That's why the blood and the bone is called as connective tissue, because they having a matrix and the cells as well as the fibers. What's a fiber in the blood? It's the collagen. Okay. So plasma, we call in blood, you know, plasma. So, you know, blood, when you collect the blood from a blood vessel, so if you go to a doctor having any problem, so they used to take blood, okay, in a test tube. So there are different kinds of test tubes, you know. I think these things you should know. When you collect a blood, okay, there are two kinds of test tubes. One is a normal test tube which doesn't have any thin adder, okay, plain glass tube which is having a cork which is covering on the tip. So that's a plain test tube. There's another one we call EDTA. EDTA tubes means at the bottom, in the test tube, EDTA is coated. EDTA in a sense that helps not to clotting. So you know, when you take the blood out, it will clot because there are platelets are there. So if you have any kind of bleeding, it stops, no, without you do anything. Small kind of bleeding when small blood vessels are ruptured. When you have an injury, so it's bleed for sometimes, then it stops because of blood coagulation, blood clotting mechanism. It's naturally happen. So there are more factors, and the platelets, the fibers are there, so they form a mesh and stop further prevent bleeding. So that's happened. Okay. If not clotting, what happens? Continuously blood is lost. So finally the people will die, an animal will die. So to prevent that, with having a clotting system. So that's happened naturally. When there's a damage, there are factors which is released during the time of damage, and those factors cause a cascades, a sequence of events, and that stops further bleeding, make a clot, make a mesh. So that's what, when you take a blood in a plain test tube without anything, it will clot. Then how you are going to get the serum and analyzing various things from the blood. So for some purpose of study, we used to take blood in a plain test tube. For some kind of study, when you want to study these enzymes, liver enzymes, and when you want to study hormonal activity, so those things, so when you are collecting, the blood should not clot. So in that case, the tube is coated with EDTA or heparin, okay, without clotting. So you collect that, you keep it so that blood won't clot when you keep in the EDTA tube or heparinated tube. Okay, so the blood won't clot. So what happens if you take in a normal tube without coating any of these chemicals, so any of these substance? What happens after sometimes? Okay, you see The bottom, it forms a clot. Okay, reddish part is there, and above that, somewhat pale yellow, pale something yellow. So that is the plasma. So blood consists of plasma and cells. Plasma. What is a plasma? Plasma, which has the matrix. Okay. Serum. What is a serum? What is a plasma? These two are different. Okay. If in case of blood, you get the blood in a test tube. So I'm talking about the blood in a test tube. You collect the blood in a normal test tube without coated anything, a plain test tube. So if you keep sometimes outside, at the bottom you see some clot, reddish clot. Above that you see the yellow color, yellow, pale yellow color. After sometimes, okay, when you rotate them in centrifuge, you get the serum separated. Not only when you use centrifuge, just you keep sometimes outside. The top part will be pale, like serum, or we call sort of, what's the color? Very yellow, not yellow, pale, something pale, yellow, something like that. So that is the serum. Okay, serum has enzymes. Okay, plasma has this protein, so that's different. Blood, plasma, and cells separated, you get the plasma. From the plasma, you get the serum. Okay, divide of fibrin, okay, collagen, we call that serum. Okay, just refer plasma and the serum. So blood consists of fluid matrix, which is called as plasma. A variety of cells, protein, monosaccharides, product of fat degradation, and other circulating nutrients like nutrients, waste, electrolytes, acid-base balance, chemicals, and intermediates. Okay. This is just to show you, maybe I would have shown this. So this you study in practical, okay? The parts. Okay, pole, not horn, okay? Pole means no horns. Forehead, bridge of nose, muscle. Muscle comprises the nostrils as well as the oral cavity. That's muscle. Jaw, throat. Shoulder blade, and it's a point of the shoulder, just in the tip of the shoulder. Dewlap, it's a skin flap. Brisket, and elbow, knee, shank, heel, and the parts like back part, chine, line, and rump. So these things we have studied, we will study in our practical as well. Tail, the head of the tail, the pin bone, which is aside from the head, tail. There's thigh region, stifle joint, udder, and so on. Okay, so use these things you study, practical. So that's all for this anatomy, this part. Okay, so just give me 1 minute, I'll start another section. Okay, how to go this. Okay, just give me 1 minute, I have to open up another slide. Okay. If you give me 1 minute, and the next section is the nervous system. You may know what is a nervous system. So nervous system is very important to connect the things, connect to us, to the environment, connect the body parts itself internally. It has to connect the digestive system, it has to connect the urinary system, so connecting. Okay. System, there are two main components. central nervous system and the peripheral nervous system. Please give me 1 minute. It's having some problem in opening the document.